Hello, bowel cancer, also known as colorectal cancer, is one of the most common diseases worldwide. It affects both men and women and, if not detected early, can be fatal. In this video, we'll discuss the 10 warning symptoms of bowel cancer that you can never ignore. It's crucial to be aware of these signs and seek medical help immediately if you experience them. You'll also see the types of tests, the factors, and how you can prevent bowel cancer. So stay until the end of this video so you don't miss a thing and know everything and more about bowel cancer, which affects millions of people around the world. Let's start with the symptoms. Symptom 1. Changes in bowel habits. One of the first changes you may notice is a change in your bowel habits. This includes persistent diarrhea. If you notice that you have frequent and continuous diarrhea, this could be a warning sign. Frequent constipation, having difficulty passing bowel movements regularly, with hard, dry stools, is also a symptom to look out for. Bloody stools. If your stools have blood in them, whether visible in the stools or on toilet paper, this could indicate a problem with your colon. Symptom 2. Anal bleeding. Anal bleeding is an alarming symptom that should not be ignored. If you notice blood in your stool, on the toilet paper or in the toilet bowl, this could be a sign of bowel cancer. It is important to note that rectal bleeding is not normal and requires immediate medical attention. Symptom 3. Abdominal pain. Persistent abdominal pain, which is a symptom of bowel cancer, often manifests itself subtly at first and can be confused with other common gastrointestinal conditions. This pain is usually characterized by abdominal discomfort. This can resemble a feeling of bloating or pressure in the abdomen. The discomfort is often vague and nonspecific. Abdominal bloating. Bowel cancer patients sometimes report a feeling of abdominal bloating, as if they were full even after a light meal. Frequent gas. Frequent gas or flatulence can also be a symptom associated with abdominal pain in bowel cancer. Symptom 4. Unexplained fatigue. Fatigue that doesn't go away, even after adequate rest, can be a symptom of bowel cancer. If you constantly feel tired and lack energy, it's important to investigate the cause, as unexplained fatigue can be an indication of an underlying health problem. Symptom 5. Unintentional weight loss. Unintentional and unexplained weight loss is a worrying symptom. If you are losing weight without making any changes to your diet or lifestyle, it is essential to seek the advice of a doctor. Unintentional weight loss can indicate an underlying health problem, such as bowel cancer. Symptom 6. Anemia. Anemia is a condition in which the body has a reduced amount of healthy red blood cells to carry oxygen to the tissues. In the context of bowel cancer, anemia can occur due to chronic gastrointestinal bleeding. Symptoms of anemia include weakness. A constant feeling of weakness, lack of energy and fatigue is common in people with anemia. Pallor. The skin and mucous membranes, such as the inside of the lips and eyelids, may appear paler than normal. Shortness of breath. Anemia can result in shortness of breath, especially during simple physical activities. Symptom 7. Feeling of incompleteness after evacuating. If you often feel that you haven't completely emptied your bowels after a bowel movement, this could be a sign of obstruction caused by a tumor in the intestine. This feeling of incompleteness can be uncomfortable and requires medical investigation. Symptom 8. Mucus in the stool. The presence of mucus in the stool, especially if it is persistent, should be investigated. Mucus in the stool can be a symptom of bowel cancer, among other gastrointestinal conditions. Don't ignore this sign and seek medical advice for a proper diagnosis. Symptom 9. Changes in the shape of the stool. Narrow, ribbon-like stools can be a sign of intestinal obstruction. Keep an eye out for any changes in the shape of your stools, as this could be an indication of problems in the gastrointestinal tract. Symptom 10. Family history of colorectal cancer. If you have family members with a history of colorectal cancer, you are at greater risk of developing the disease. It is crucial to have regular checkups and inform your doctor about your family history. A family history of colorectal cancer is an important risk factor to consider, and preventive examinations may be recommended. Now that you know about the main symptoms of bowel cancer, it's important to know about early detection, which is key to treating bowel cancer. When identified in the early stages, the chances of a cure are significantly higher. So if you or someone you know shows one or more of these symptoms, don't hesitate to seek medical attention. Now, what are the risk factors for colorectal cancer? Risk factors for colorectal cancer are characteristics or conditions that can increase a person's likelihood of developing this disease. Some of the most common risk factors include: older age. The risk of colorectal cancer increases significantly with age. Most cases are diagnosed in people over the age of 50. Family history. If you have first-degree relatives, parents, siblings, who have had colorectal cancer, you are at greater risk of developing the disease. This may indicate a genetic predisposition. Intestinal polyps. The presence of polyps in the colon is a risk factor, as some polyps can become cancerous over time. Intestinal polyps are abnormal growths that form on the wall of the intestine. Some polyps can turn into bowel cancer over time. Therefore, the detection and removal of polyps during screening examinations is essential in the prevention of colorectal cancer. Chronic inflammation of the colon. Conditions such as ulcerative colitis and Crohn's disease increase the risk of colorectal cancer, especially when the inflammation is prolonged. Watch now which risk factors depend on you. Changing habits. Fortunately, there are risk factors that can be modified through lifestyle changes and health care. These include: diet. A diet rich in fiber, fruit and vegetables can help reduce the risk of colorectal cancer. On the other hand, excessive consumption of red and processed meat is associated with an increased risk. Reducing the intake of red meat and processed foods and increasing the consumption of foods rich in fiber is a positive change that can be made. Regular exercise. Lack of physical activity is linked to an increased risk of colorectal cancer. Exercising regularly not only helps to maintain a healthy weight, but also benefits the digestive system. Smoking and alcohol consumption. Smoking and excessive alcohol consumption increase the risk of colorectal cancer. Quitting smoking and reducing alcohol intake are important steps towards prevention. Healthy weight. Maintaining an appropriate weight is essential for reducing the risk of colorectal cancer. Obesity, especially in the abdominal region, is a risk factor. These changes in habits are important not only in preventing colorectal cancer, but also in promoting general health. By adopting a healthy lifestyle, you can significantly reduce your risk of developing this disease. It is essential to remember that prevention is a fundamental part of healthcare, and raising awareness of risk factors and adopting healthy habits play a crucial role in the fight against colorectal cancer. Why is bowel cancer increasing in young people? Bowel cancer is becoming more common, and this is cause for concern. Some of the factors contributing to this increase include: unhealthy diet. The prevalence of diets rich in processed foods, saturated fats, and low in fiber has contributed to the increase in cases in younger people. Sedentary lifestyle. A sedentary lifestyle and a lack of regular physical activity are risk factors for bowel cancer. Obesity. Being overweight, especially in the abdominal region, is associated with a higher risk of developing colorectal cancer. Smoking and excessive alcohol consumption. These harmful habits are linked to an increased risk of bowel cancer in young people. It is important that young people are aware of these risk factors and adopt a healthy lifestyle from an early age to reduce their chances of developing colorectal cancer. How can you protect yourself from bowel cancer? There are several measures you can take to protect yourself against bowel cancer. Maintain a balanced diet. consume foods rich in fiber, fruit and vegetables, and limit your consumption of red and processed meat. Exercise regularly. Physical activity helps keep the digestive system healthy and reduce the risk of bowel cancer. Avoid smoking and excessive alcohol consumption. These habits significantly increase the risk of the disease. Maintain a healthy weight. Maintaining an adequate weight is fundamental to preventing bowel cancer. Get screened. See a doctor regularly and get the recommended screening tests, such as colonoscopy, from the appropriate age. What does the checkup to prevent colorectal cancer look like? The checkup to prevent colorectal cancer involves regular examinations aimed at identifying the presence of polyps or cancer in the colon. Some of the tests include fecal occult blood test. This test checks for traces of blood in the stool, which can indicate the presence of polyps or cancer. Sigmoidoscopy. This exam allows the doctor to view the rectum and part of the colon to identify polyps or other abnormalities. Colonoscopy. Colonoscopy is the most comprehensive examination, in which a flexible tube with a camera is inserted into the colon to check for any abnormalities. This is one of the most effective tests for the early detection of colorectal cancer. What is a colonoscopy and why is it important? A colonoscopy is a medical procedure in which a doctor inserts a flexible tube with a small camera into the colon to examine the organ's mucosa for polyps, lesions, or cancer. This test is essential because it allows early detection. Colonoscopy is one of the most effective methods for the early detection of polyps or colorectal cancer, which significantly increases the chances of successful treatment. It allows for the removal of polyps. During colonoscopy, the doctor can remove polyps, thus reducing the risk of them becoming cancerous. It is essential for screening. Colonoscopy is recommended from the age of 50, and the frequency of examinations depends on individual risk and previous findings. In summary, colonoscopy plays a vital role in the prevention and early detection of colorectal cancer, making it an essential part of regular medical care. Always remember that prevention and early detection are crucial in the fight against bowel cancer. Maintain a healthy lifestyle, be aware of warning symptoms and follow your doctor's guidelines for regular screening and examinations. If you liked this content, click the like button to help spread the message about the symptoms and what you've done to prevent bowel cancer for your health. You can also share this video on your social networks to help reach more people. And don't forget to subscribe and activate the bell, because on this channel we learn how to take care of our greatest asset, which is our health. Don't forget to comment if you've experienced or had any of these signs of cancer and what you've done to prevent it and what has changed in your life. Don't forget to share your experience, as your comments are very important to us and can help many people to take care of their health. And what part of the United States or the world are you from? I'm going to leave you with 2 relevant recommendations here, a playlist of benefits and another video that your health will love. Thank you very much for following me to the end, and let's promote everyone's well-being together. And see you in the next video.